What's going on, guys? Dr. Corey Burt here. Hey, today I'm going to discuss the basics of NUCCA, what the process looks like and how it differs from traditional chiropractic, and really how we're able to get our patients to hold their adjustments for longer periods of time. So let's jump right in. First things first, let's identify the health problems that we help solve. Now, what I've done is created a list of the top spinal related problems that we have the most success with as upper cervical chiropractors. Of course, the most common condition, without a doubt, is migraine headaches. 90% of the time, the migraine symptoms are going to live within the rotation or the twisting of the top two bones in the neck. It's absolutely a structural problem we're dealing with. Now, of course, in some circumstances, the migraine is going to be related to food, diet, increased emotional stress. But 90% of the time, it's going to be a structural cause, likely from an injury. Trigeminal neuralgia, very similar here. We find that when the upper neck is injured, this is going to distort the brainstem and the cranial nerves, which will cause this just horrific lightning bolt facial and jaw pain. They actually call this one the suicide disease because it's so severe. So it's nice when we can correct the structural root cause here. Hydrocephalus, this is when the brain has a backlog of cerebral spinal fluid that's going to cause just severe pressure buildup inside the head. 99 out of 100 times is going to be related to the misalignment of the upper neck bones that's going to cause the fluid backup. And when we're effectively able to unrotate the bones, through upper cervical care, NUCCA, patients literally will tell me that it feels like I flushed the toilet inside their brain. Just incredible. EDS, fibromyalgia, so that's EDS as in Ehlers-Danlos syndrome, both nervous system conditions that can almost always be traced back to the brainstem being distorted by the structural misalignment of the upper neck. Same thing with seizures, Chiari malformation. The brainstem is going to be compromised by a head neck injury, whether that's a concussion, a car crash, could be a lot of things. Meniere's, a condition of severe dizziness with ear ringing, almost always going to be related to the head and the neck being injured, which is going to compromise the cranial nerves of the brainstem that really just go right to the ear. So moving on, believe it or not, 80% of the time we are able to trace sciatica back to the neck. In order for the leg pain to truly go away in the long term, you need to get the pressure off the neck first. And then you can start working, on the low back. And of course, these are for the chronic cases. Now, acute, you definitely want to work right on the low back too. But like I said, if you neglect the neck and only look at the low back and treat the low back, you're never going to correct the root cause. And everything's just going to be temporary, including surgery. And then, of course, 50% of my clinic is going to be the general neck, shoulder, back, hip, knee pain. Now, the biggest thing that I've noticed with my patients is that they have all tried one or more of these solutions before seeing me. Now, it's not that any of these solutions are ineffective. It's just that the patient has an underlying neck problem that has been overlooked when really it needs to be looked at in detail. It's incredible to study how the rest of the spine will compensate just because of an underlying neck problem. Moving on, NUCCA really is an organization that stands for National Upper Cervical Chiropractic Association. It's the protocol I use specifically here at Elite Upper Cervical. We utilize this protocol to evaluate and correct the alignment of the head and the neck, which is ultimately going to restore the integrity of the brainstem and other important nerves. Now, what you'll notice with the NUCCA protocol It's not just a one-size-fits-all approach. The entire process is going to be completely customized for each individual patient. Now, I always start with a phone conversation to see if NUCCA is the right fit. The last thing that I want to do is schedule someone into the clinic if they're looking for something else or they've got a condition that I don't think I can help them with. You'd be surprised of how many people call in wanting their back cracked, or they want to come in as a one-off, get one adjustment, and expect to be fine forever. So if that's the case, right, I'm going to point them into the right direction for what they want. But yeah, if they're truly looking for a long-term solution and are willing to commit, of course, I'll schedule them right in, get their assessment done. Now, the assessment itself involves, a series of 15 tests, ranging all the way from posture analysis to testing balance and coordination. A lot of different tests, but ultimately all of them are specific and objectively measured to remove as much of my bias as we can. We want them to be reproducible, scientific, objective. And the ultimate goal of all these tests are to determine if the patient's condition is stemming from their neck and, of course, the misaligned neck. Because if it is, that's where we're a great fit. And that's where we move forward with the process. Now, because the relationship between the head and the neck is the most complex region of the entire spine, we have to evaluate it properly. Now, to do that, the first thing we need to do is get a 3D image of the head and the neck to really see the exact position of the neck bones. Now, to do that, we need a picture from the side. You can see here, the side, the front, and then the top. And think of this as being the blueprint from which we start from. And now that we have the blueprint, we need to study each image and also measure each image. Now, fortunately, we have access to advanced spinal software that is going to allow us to measure the head and the neck down to 1/10 of a degree. You can see here. Now, I'm not going to get into too much detail, but as you can see, the measurements and these different lines are measuring specific angles of the head and the neck bones. The software is going to compute and analyze all three of the images together, and really an end goal, ultimately, like the software is going to tell us the most specific way to correct the head and the neck bones. All the measurements are going to be listed green and, down here below each image. Now you may be wondering, gee, does this really matter? Do you really need to be that specific? And the answer is absolutely yes. If someone is not holding their adjustment or their alignment, meaning that they come in and get adjusted every single visit that they come in, this tells me that I probably messed up and that my measurements are off. Because the more accurate that I am with the math and the accuracy of the adjustment, the longer the adjustments are going to hold in place. I should not have to continue to adjust someone 4,000-5,000 times throughout their life. It's just not ideal. Like me personally, I've been holding my correction for 6 months now. So yes, it does matter regarding specificity. Now, once I have the specific coordinate, I will perform the NUCCA correction. Now, notice she is lying on her side, relaxed. The position of her head and neck are completely customized. There's absolutely no twisting, popping, or cracking of the neck. Definitely no thrusting into it. It's very gentle pressure right underneath the ear, just enough to rebalance the head over the neck. Now, the only thing you'll feel is the weight of my hand behind your neck, right underneath your ear. That's all you feel. But after the correction, we want to take 2 more pictures to really verify that the bones are, in fact, moving in the right direction. You know, here we got a great correction. You know, the first image pre on the left, you can probably see that from here, you know, leaning way over to the right. And then afterwards, post, it balanced right out. So great outcome here. Now, sometimes I will have to do a bit more work until we can actually get a good correction. But yeah, you can see that here we reduce the rotation of the top bone in the neck, the atlas bone, from 5 degrees to 3 degrees, and then finally out here down to 1 degree. And that's where we stopped. But yeah, it's great to know that when you can get a good correction and you know that it is continually improving. So moving on, I start by monitoring their correction for about 3 months, because this really gives us a good idea of what it will take to get their correction to stabilize and stay in place. Because remember, you know, my ultimate goal is to not perform an adjustment moving forward. That, you know, the goal is to check your measurements and say you're doing great. Because if you think of it like this, you know, if we correct them today, and then they come back next week and their measurements are still balanced, why would I perform another adjustment? It just wouldn't make much sense and could potentially make them worse, because they're in alignment already. So why would I do any more adjustments? Anyways, but yeah, like the patient is going to be recovering and healing when they are in alignment, not when I adjust them, you know, every week for the rest of their life. Additionally, the NUCCA chiropractic model is very similar to the medical and dental model. Let me explain. So think of it like this. With medicine, let's say you go in to get your blood tested, and what do you expect and hope the results to be? Hopefully normal. And same thing with dentists. Like, let's say you go in, you get images and x-rays of your teeth. The dentist is going to analyze them, study them, and he's going to check for soft spots on your teeth. And what do you want to hear? Well, that you're fine and that you don't need any treatment. And so it's no different with NUCCA. You know, you get tested with the hopes that you're fine and that you don't need an adjustment, no treatment. So that's the idea there. Anyways, that is everything. Hopefully this all makes sense. Feel free to visit our website, eliteuppercervical.com, to learn more. You can also schedule your consult there, free phone consults. Of course, reach out to us if you have any questions. But yeah, thanks for tuning in, and hopefully we will see you next time. Take care. Bye-bye. Alrighty. That was fun. That was fun. Here we go. Get out of this. End stream.